Automated Dispensing Systems by Stephanie Jones and Danielle Heckman. This presentation will discuss automated dispensing systems' impact on healthcare delivery. We will go over how health information technology impacts healthcare delivery, as well as a brief overview of the types of technology used with automated dispensing systems, examples of different automated dispensing systems in the industry currently, a cost analysis of automated versus manual dispensing systems. We will also go over the impact automated dispensing systems have on medication dispensing errors, work processes, as well as the advantages and disadvantages We will now discuss how health information technology impacts healthcare. Over the years, health information technology has directly impacted the delivery of healthcare. It provides a technological switch that specializes in combing communication, information technology, as well as healthcare to improve patient care. Utilizing technology like automated dispensing systems allow providers this portion of the presentation will provide an overview of automated dispensing systems. In the 1980s, automated dispensing systems were introduced to hospitals to assist with administering medications due to concerns surrounding manual dispensing errors. Research began to find ways to decrease errors surrounding dispensing prescriptions manually. Implementing automated dispensing systems were slow in the beginning, but by 2008, nearly 80% of hospitals use automated dispensing systems in replacement of manual floor stock systems. Automated dispensing systems are electric drug storage cabinets used to control and track the use of hospital medications, typically within inpatient facilities. Users, predominantly nurses, are allowed access through user identifiers and passwords. Computerized physician order entries, or also known as CPOEs, are entered into a patient's EMR. From there, the automated dispensing system captures the CPOE and notifies nurses of what medications were ordered for the patient. Software within the system tracks CPOEs entered by physicians and any users who access the system to obtain a patient's medication. The system also notifies the patient billing department regarding medications ordered and administered while the patient is admitted. Automated dispensing systems can utilize various databases within the hospital. For example, CPOEs are entered into a patient's EMR by the treating physician. Based off the patient's location within the hospital, the CPOE is transmitted to the closest dispensing system. Then, a nurse will access the automated dispensing system using their user credentials and locate the correct patient and the correlating CPOE. Once found and selected, the drawer containing the ordered medication will open. Once the medication is contained, the clinician can simply log out. At bedside, the clinician will cross-reference the patient's ID with the one associated on the medication to ensure the correct patient is receiving the correct medication ordered. Once confirmed, the dispensing system receives an administered notification that populates into the patient's EMR, thus notifying the patient billing department to charge the patient for the medication. Here is a diagram of how CPOEs are transmitted from a patient's EMR to the dispensing system. From here, other treating physicians, as well as nurses, are able to retrieve ordered medications using their assigned username and password. Once medications are obtained, the system confirms receipt of the prescription as well as the access member who used it and updates the patient's EMR record to display such. The dispensing system also notifies once medications are completely out and when they will need to be refilled. Following slides will discuss the different automated dispensing systems used today. The type of automated dispensing systems used today surround four major brands. Similar in design, each provide their own qualities. The first most popular brand in automated medication dispensing is called the Pyxis. First in their field, since 1990, the Pyxis provided hospitals with one of the first medication dispensing units. Shortly after, in 1992, the Omnicell hit the market. The Omnicell differed from the Pyxis because unlike the Pyxis, the Omnicell provided plexiglass drawers, allowing users to see through to the medications desired. This made workflow quicker and more user-friendly. Following the Omnicell was the AccuDose. Created in 1998, the AccuDose was from the third largest pharmacy automated production line. The unique feature about the AccuDose is that it allowed nurses to hold their place within the system if interrupted. They had the ability to go back to where they left off within the system to retrieve the medications. One of the final models in the industry today is called the Cerner RX Station. The Cerner RX Station is one of the newest models in the market. Since Cerner is one of the main creators of EMR and clinical documentation software, the system was built with both automated dispensing and patient record documentation in mind. All of these versions provide options for hospitals to choose which best fits their work as well as their budget. This chart displays the comparisons of three automated dispensing system models discussed on the previous slide. It also displays the pros and cons between each model and what can possibly help with consumers when deciding which model will fit their business needs.
The following is an example of the cost-saving benefits of using automated dispensing systems and does not include the estimated cost that could be saved from decreasing medication dispensing errors. The following cost comparison analysis is based on a study showing cost difference in a large academic hospital in Thailand that implemented an automated dispensing system. All of the costs covered over a 10-year period for a manual dispensing system would cost an inpatient pharmacy $15,782,608. The cost for an automated dispensing system would cost $17,632,232 over the same 10-year period. The automated dispensing system did not cover all types of medications, however. It only covered 220 types of tablets and was not used all day long, which led to it only covering 22.8% of daily prescribing. If the automated dispensing system was able to cover 75% of all prescriptions, then the actual cost would be $15,737,803, which would end up saving an organization $1,894,429 over a 10-year period. These numbers show that over time, the actual cost after initial purchase price would save costs over time without taking into account the cost savings of reducing the number of medical errors that have been proven to decrease using automated dispensing systems. This portion of the presentation will discuss how automated dispensing systems can help with alleviating certain business needs like medication dispensing errors. A medication dispensing error can be defined as any discrepancy between a prescription and the medicine that the pharmacy delivers to the patient or distributes to the ward on the basis of the prescription. There are approximately 22 classifications of medicine errors that occur throughout hospitals around the world. The 6 main types of medication errors that happen are prescribing faults, prescription errors, transcription errors, dispensing errors, administration errors, and cross-setting errors. A few common errors that take place in pharmacies and hospitals all over the world would be poor communication, ambiguities in product name or the directions for use, error in reading medical abbreviations or writing, poor procedures or techniques, and patient misuse because of poor misunderstanding of the directions for use of the product. In this picture are 3 types of prescription eye drops that can be prescribed to patients, each with different medication makeup and solution percentages. The bottles and packaging all look exactly the same, and if in a hurry or not correctly prescribed can lead to easy confusion and incorrect distribution to a patient, causing a medication error that may have adverse effects. Just by a quick glance, it would be very difficult to distinguish a difference between the 3 and would be very easy for a technician or pharmacist to grab the wrong box while in a hurry or being distracted by conversations and other events that take place over the course of a day in a pharmacy. Automated dispensing systems can help eliminate these simple errors by taking the distribution of these medicines away as a role nurses and pharmacy technicians have. The medicines can only be dispensed after cross-referencing the patient's identity and prescriptions ordered for that specific patient. Medication errors cause at least 1 death every day and injure approximately 1.3 million people annually in the U.S. That leads to over 7,000 deaths a year, and about 2% of these errors result in adverse effects in hospital patients. As cited in Bates, it is estimated that approximately 0.3 errors occur per patient per day, and approximately 1% of these errors cause adverse drug events. These numbers are a contributing factor in the overall total of 1 million injuries and 44,000 deaths that take place each year due to medical errors. The Center for Drug Evaluation and Research began receiving reports of medication errors in January of 1992, and 6 months later, the Medication Errors Subcommittee was formed to evaluate and recommend appropriate action on these reports. This graph shows the results of a study conducted from March 2007 through April 2007 at a military hospital in Clamart, France, which determined the potential for adverse drug events to occur for a patient had the nurses not caught the errors missed by pharmacist technicians and pharmacists themselves. There were a total of 734 medication cassettes dispensed. The cassettes were filled with the proper doses to last each patient within a 24-hour period, and they were filled by pharmacy technicians and checked by pharmacists and nurses before being dispensed to the patients. Over the month, there were a total of 179 prescription errors either found by the pharmacists or nurses, leading to a 2.5 error dispensing rate. The two most common errors were improper dose errors and unauthorized drug errors. Most of the unauthorized drugs dispensed were common name or packaging confusion or incorrect dosage for a drug. This graph shows 45% of the errors could have led to adverse drug events had they not been detected. 16% of those could have led to serious adverse drug events, and 29% could have caused significant adverse drug events. This portion of the presentation will discuss how healthcare providers use automated dispensing systems to strengthen the healthcare their patients receive. Of the findings associated with automated dispensing systems, most nurses are the ones who utilize these cabinets, and their perceptions were most studied as opposed to healthcare leadership. Most nurses are receptive to the use of automated dispensing systems and felt satisfied with the effect they had on their job performance. In a study of 2 hospitals in Qatar, 94% of nurses who participated in the study agreed that automated dispensing systems allowed them to do their job safely. 87% agreed they could administer the right dose of medication at the right time, and 91% agreed that the physical layout of the automated dispensing system was user-friendly. Overall, most nurses have had positive experiences and enjoyed using the automated dispensing system. The positives to using these systems for nurses was the ability to reduce or prevent medication errors, and the system was accessible and easy. However, there were some downsides that could be improved over time. Not all medicines in the hospitals were compatible and stored in the automated dispensing system. In the more busy units, some nurses experienced longer wait times to access the ADS, and the cabinet contained an open matrix drawer system which would be better function if it had locked individual compartments. The most common recommendations made by nurses for better functionality of the ADS would be to have the ability to include all medications that are accessible in the pharmacy, have the pharmacy enter the prescription in the system quickly, which would allow nurses access to orders quicker, and install more cabinets in areas where prescriptions are administered frequently to avoid queuing. It is important to remember technology does not have a brain, and therefore it cannot read minds. When entering information, errors can be made even if the correct dosage was entered. Mix-up in similar drugs can happen. It is important to train all staff on the uses of these systems and also ensure the proper procedures are followed for checking proper dose and medication is administered to the correct patient. With these new systems, the role pharmacy technicians have in pharmacies are changing as well. They are responsible for the restocking of the ADS and checking the expiration dates a couple times a week. This has also freed up pharmacists' needs to dispense medications, as this is done primarily by the technicians and the nurses now.
Now, we will figure out the advantages as well as the disadvantages of using automated dispensing systems. Before a majority of hospitals switched to automated dispensing systems, methods like manual distribution were used to provide patients their medications. Floor stocks and medication carts that only held 24-hour supplies of patient-specific medications were kept on the floor. However, issues surrounding delayed dose delivery, the loss of patient medication doses, and even the borrowing of patient medications cause issues for patients as well as nurses down the line. Implementing automated dispensing systems provided hospitals a way to efficiently store medications as well as track those who access the system. Once implemented, automated dispensing systems have displayed many benefits for hospitals. For example, increased access to medications through using an automated dispensing system allowed nurses and pharmacists to have more time to spend with patients instead of increased time spent on locating drugs. Now that medications are in an electronic locked cabinet, they are more secure and only given access to those who have usernames and passwords. The automated dispensing system also serves as a security measure because access is monitored and tracked. Anytime someone accesses the dispensing unit, their username and password is tracked within the automated dispensing unit system. When interfaced with a pharmacist's computer, CPOEs can be reviewed to check for accuracy before administration. This can alleviate errors surrounding misspelled medication as well as dosing errors. Since automated dispensing units are connected to hospital networks, dispensing units allow interfacing within hospital databases like patient billing. Once the drug is administered, the patient's EMR chart is updated, thus notifying patient billing to add the charge to the patient's account. That same barcode technology is used for confirming medications ordered and making sure they are given to the correct patient at the time of administration. Scanning a patient's ID wristband can reduce medication dispensing errors, thus increasing efficiency of the patient's care. Though automated dispensing systems may have many advantages, there are still some disadvantages that can impact patient safety. For example, if automated dispensing systems aren't linked to a pharmacist's computer, the pharmacist will not be able to accurately profile the patient's order. That can cause situations like unsafe doses and duplicate therapies to go unnoticed, thus causing issues for the patient later on. Another example are overrides. Overrides usually occur when the dispensing system is accessed in an emergent situation. Sometimes the orders are not reviewed properly and can go missed if errors are presented on the order. Lookalike drugs are also something that is common to happen within the dispensing system. Since the medications are listed in alphabetical order, two drugs next to each other with similar names can be misplaced and or mistaken for the other. Stocking procedures is another example of a disadvantage within the dispensing system. Even though pharmacists are primarily responsible for stocking the dispensing system, nurses at times can restock medications when not used through their shift. If a barcoded system within the dispensing unit isn't used within the software to track medications, manually, the nurses are responsible for double checking. Through human error, this can cause oversight as well as errors with replacing the medications to the respective drawers. Here's a clip from Showtime's hit show Nurse Jackie. In this clip, the nursing staff is being introduced to their new automated dispensing system. Even though if you look closely, you can see something that one of the nurses do to try to override the system. Overall, automated dispensing systems are a great way to integrate technology into healthcare. The cost savings after initial implementation can be twofold, as it saves on overall distribution costs and reduce medical errors that occur with implementation. Even though users' negligence, like misreading or overrides, can still cause errors, the benefits like security, organization, and time efficiency can strengthen the care patients receive.